Hi, my name is Misty Cox, and I did my diversity and vulnerable populations assignment on individuals with substance use disorders. This is a population that I am very passionate about working with, and I look forward to sharing the information that I gathered. So, the American Psychiatric Association defines substance use disorders as complex conditions in which there's an uncontrolled use of substances despite the harmful consequences. SUD diagnoses directly affect nearly 49 million individuals in the United States each year. And we have data that shows that there was an increase in diagnosis of SUD cases between 2021 and 2024. So it went from 8.7% of the population to 9.8% in 2004. So the chart on the left provides a breakdown of substance type, with alcohol misuse being the most commonly abused drug in the United States. There are a number of reasons why individuals would turn to substance use in general, and those include being everything from just being curious, especially young people, to the social pressures, and that spans all ages, as well as a coping mechanism for past trauma or pain or abuse. And personally, I've found the latter to be the most common among my clients, the clients that I work with, and that is that they are trying to block out painful past traumatic experiences. And as I've listened to their stories and heard them describe childhood experiences, I don't wonder why they would turn to substances to cope. That some of their experiences are pretty difficult, and well, a lot of their experiences are. Other other things that determine substance misuse are their social determinants, so including housing and employment and where one lives geographically. Like those things need to be considered, and it's especially important to recognize that vulnerable populations are more dramatically affected by substance use. So that your more vulnerable populations are members of the BIPOC community, your Black, Indigenous, Pacific Islander, and people of color populations that are disproportionately affected by substance use and even recovery opportunities. For my interview, I had the privilege and opportunity to interview two social workers at the agency I intern at. So I intern at an intensive outpatient program. The agency is called The Haven, and I was able to visit with Sally Webster, who is a CSW and the clinical director of the program. She's also my supervisor, and I really enjoyed learning from her, and I'm looking forward to continually learning from her. The second individual is Kevin May, and he is retired military, and he did a lot of work in as a behavioral health specialist in the military prior to joining us at the Haven. He has a lot of experience, and especially in the criminal justice system. Interestingly enough, both identified trauma and PTSD as the most common presenting problems among this population. And in fact, Sally said, quote, untreated trauma, poverty, stigma, and lack of connection impact substance use, close quote. Both also emphasized the cultural dynamic of justice involvement, which is something I hadn't considered. Kevin said, quote, prison is a big culture to overcome. Trust, possession, and safety become obstacles to their healing, or close quote, which I also, I recognized that as I've been working with this population, but it was definitely a concept and idea that was driven home after my interviews with them. So when it comes to engagement with this population, it's really important to meet them where they are. And that's something that Sally talked a lot about. She said and talked about the importance of meeting them where they're at, where legitimately where they are at, instead of where we think they should be. She said that that is a core cultural value as a social worker working with those with substance use disorders. She went on to talk about how important it is to understand systemic oppression, stigma, and labels, and how critical those can be in they can often act as barriers to recovery. Many of our clients are court-ordered to participate in our programs, so there's a big distrust of institutions and authority, and that has to be acknowledged and respected. Um, Allowing clients to the autonomy to set the pace in their recovery is also critical. You can't want it more than they do. I've heard Kevin often say, and it's a common phrase in our field as well. Just that, we meet them where they're at and we walk with them as they're journeying on their path, and that's the best that we can do, because ultimately they're the ones putting in the work. So, as far as assessments and interventions go, assessment is ongoing, and not only does it incorporate their initial intake and assessing where they are in their substance use, their goals, what they perceive their problem to be. But it's also ongoing as we meet in groups with them and meet one-on-one with them. It includes observing body language and patterns and habits and presentation. At one point, excuse me, in my internship, I remember talking with a female client and just pointing my finger and just seeing the reaction on her face. She didn't say anything. There was a tightening of her face, and I recognized it very quickly. And I asked her about that, and she talked about her experience in prison and how pointing a finger, and I wasn't pointing it at her, just pointing my finger, and she said that brings up that triggers her. And it was interesting that those things are ongoing, and we have to be aware of those things as we're talking with clients, and as we seek learning and development. Kevin May went on to say, as a therapist, or quote, as a therapist, you are listening for cues, close quote. Cultural norms regarding community, family, and help seeking guide assessment is something that Sally talked about as well. When it comes to evaluation, something Kevin said was that a win is a win, no matter how big or small. And I really love that. And it's definitely something that I embody in my work with those that I come into contact with. It's so important to remind them of how far they've come and the progress that they've made. Kevin talked about showing clients about a month into working with them. He will pull up the photo that was taken of them when they started the program and provide that visual for them to see how far they've actually come and the work that they've put in. And he says that it's fairly impactful for many of them to have that visible representation that, yes, it's only been a month, but I've come far and I've made progress. It's important that when it comes to evaluating, that we help individuals self-evaluate, and so that they can find their own why and their own motivation in their progress. So I was talking to an individual at one point about, this was back when I worked in the social work department of our local community college, and I was working with students and getting them enrolled into our substance use disorder counseling program. And in one of these exchanges, this potential student said, the worst thing you can do to an addict is to have someone with no personal experience trying to help them. I knew then and now how flawed that thinking is. And I personally didn't plan on working with this population, but I had a professor in an intro to social work class that said that the field has a way of finding you. And that's exactly how it worked for me. I was looking at applying to graduate programs, and there was an opportunity to pursue licensure as a substance use disorder counselor. And I thought, well, this will look good on applications and the experience will be great. What I found when I did my internship for that licensure was a passion and a sense of purpose working with this population. And I realized the worst thing you can do is fail to look beyond the exterior. There's so much stigma around substance use and individuals who are struggling with substance use disorders, and they aren't seen as human beings, and they're seen as the problems that they've caused. They're seen as the mistakes that they have made, and that causes and creates barriers that make it difficult for them to recover. This is where that cultural competence comes into play. It requires openness and questions and listening to understand, not just hear, and an awareness of systems and personal biases and even personal privilege. Something that Kevin said was, quote, "My way is not the right way, it's just a way," close quote. Seeing the human being is more than just seeing their behaviors. It's essential to see them as individuals who are trying to make their lives better in the best way they know how. For me, it's an honor to walk with my clients on this part of their journey. I don't define success by the sobriety. I did not go into this field thinking that I could help people. I go in I go in looking for the light that comes on in the aha moments, because that's really when the hope shines. And despite circumstances or systemic oppressions, these are individuals that are really looking for hope. I have a lot to learn, and I'm looking forward to what comes next. And I'm excited to continue to grow in my personal awareness and in my competency with the substance use disorder population.